Enhancing quality in healthcare practices. Improving clinical practice through the use of quality in healthcare involves several key strategies, methodologies with a consistent focus on patient outcomes. The concept of quality in healthcare encompasses various dimensions, including patient safety, effectiveness, patient-centered care, timeliness, efficiency, and equity. The first step is to establish clear quality standards that are based on best practices and evidence-based medicine. These standards should be communicated effectively to all healthcare providers to ensure a unified approach. Develop and enforce safety protocols to prevent errors and minimize hazard, such as standardized procedures for medication administration and surgical checklists. Promote a safety culture. Foster an environment where staff feel comfortable reporting errors and near misses without fear of retribution. Develop and implement standardized protocols for common procedures to ensure consistency and reduce variability in care. Utilize best practices from leading healthcare organizations and integrate them into your own practices. Identify disparities in healthcare access and outcomes by analyzing demographic data and implementing targeted interventions. Enhance physical and logistical access to healthcare services for underserved and vulnerable populations. Implementing continuous monitoring and evaluation mechanisms for performance, such as patients' outcomes, satisfaction scores, and process measures. Use data analytics to monitor performance, identify areas for improvement, and drive quality improvement initiatives. Regular auditing and feedback sessions with healthcare teams help in identifying areas for improvement and recognizing achievements. Engage in regular quality improvement activities, such as plan-do-study act cycles, to test and implement changes. Collect and act on feedback. Gather feedback from patients and staff to identify opportunities for improvement and make necessary adjustments. Another essential component is the adoption of clinical practice guidelines, protocols, and pathways. These are systematically developed recommendations that assist practitioners in making informed decisions about patient care. They are based on the latest research and expert consensus, ensuring that patients receive the most up-to-date and effective treatments. Technology aids, such as electronic health records, EHRS, and data analytics tools, can play a significant role in streamlining this process. Use electronic health records to improve coordination of care, reduce errors, and facilitate information sharing among providers. Continuous education and training for healthcare professionals to stay current with the latest advancements and practices to maintain and improve their skills. Ensure that all staff are properly credentialed and that certifications are current. Fostering a culture of quality within healthcare organizations is vital. This involves leadership emphasizing the importance of quality improvement and patient safety, encouraging staff to voice concerns and suggestions, and providing ongoing education and training. Patient involvement is also critical. Incorporating patient feedback and ensuring that care plans are aligned with their needs and preferences can lead to better adherence and outcomes. Develop mechanisms for addressing patient complaints and concerns promptly and effectively. Involve patients in decision-making processes about their treatment plans and care options. Enhance patient satisfaction. Implement practices that improve the overall patient experience, such as reducing wait times and improving the environment of care. Improve communication. Ensure clear and compassionate communication with patients, providing them with all necessary information to make informed choices. Use communication tools and practices that enhance teamwork and coordination among care providers. Implement efficient scheduling systems to reduce wait times for appointments and procedures. Analyze and streamline workflows to minimize delays and improve patient flow through the healthcare system. Encourage multidisciplinary teams. Foster collaboration among different healthcare professionals to provide comprehensive and coordinated care. Lastly, benchmarking against other peer institutions further drive improvements, ensuring safer and more effective patient care. By focusing on these areas, healthcare organizations can improve the quality of care they provide, leading to better patient outcomes, increased satisfaction, and more efficient operations. Quality enhancement is an ongoing process that requires commitment, continuous evaluation, and adaptation to meet the evolving needs of patients and healthcare environments.